Yes.
Right. So as we said here, oh yeah, the other thing too, if you're not sure, check and see where you are in terms of 11 o'clock or 12 o'clock, right? All right, so blood vessels, right? Diagrams are in your on blackboard, but there we can see there's the right atrium right there, right? Get a probe, yes we can. My fingers out of the way. Right. So there's the right atrium, and the superior vena cava drains into that right atrium right there, right? And now the branches that drain, or veins that drain into the superior vena cava, is the azygos on the right hand side. So we have to tilt the organs over to the left to see the azygos right there, right? This here just brilliant in terms of how this was separated here, ladies. Excellent work. And this is few and far between right here, where we can actually see the two branches of the internal mammary that comes from either side. So that pregnant cat right there, I actually looked at it last week. These blood vessels, as they get closer to birth and the mammary glands get bigger, what's going to happen to the size of these veins? Get bigger. So there you can see the Y, right? And most of the cats will have that running down, and that's the internal mammary right there. Then, oops, you see that?
Oh yeah, I can see it
Yeah.
now because your hand is. There we go.
Then we see the two branches right there, the brachiocephalic veins draining into that. Right now, before I forget, if I forget to write on the board here, then, right, you're on your own. But now remember, folks, veins, blue is the vein, brachiocephalic vein. There is the brachiocephalic artery. So make sure you put down vein or artery or V or A. Because if you just put down brachiocephalic, then I'm going to say, well, which one? And let's assume I ask 10 blood vessels and you don't put that, that's 5 half points that you, or 5 points that you're tossing away. Right? So, like a lot of you on the quizzes got hammered on that quiz. So rather on the quiz than on the exam. Right? Okay, so let's see now. So there's my brachiocephalic. And now we see draining into the brachiocephalic are two branches. The external jugular that branches into the brachiocephalic, and the subclavian that branches into that. Now we come and look at the external jugular. So there, all of this is the external jugular right there. All of that, inside the body cavity and outside the body cavity. And then there is the transverse jugular that runs from the left to the right. You can see it right there. You can see it looping across, and there's the external jugular on the right hand side. Yes? Then the internal jugular, that may be the internal jugular right there. So the internal jugular is going to drain into the external jugular right there. I think that it is, or maybe this one right here. Right? But no, some of the cats, they are big internal jugulars, or nice and distended ones. Then we have this one right here called the cephalic. And the cephalic, remember, is draining from the shoulder. So there is my cephalic right there. One of the blood vessels, the veins of by 141, that was a landmark for these muscles. So the cephalic is running through right there. Right there. Right? So external jugular, internal jugular, cephalic drains into it. And the external jugular then drains down into the brachiocephalic vein right there. Then we have this long vein right here, all the way here. And depending on where we are with that vein, it's going to be the subclavian under the clavicle in the chest cavity. The one that's going to be hard is in the armpit area. So there, if I want as an armpit, I'm going to have to give you some guidance. Armpit. So that branch then is called the axillary vein. Then that same vein, when it's in the upper arm, is called the brachial. And then when it loops across right here, there it is the radial. So there's the radial vein right there. Alright? So again, location. One blood vessel, where is it located? And you're looking and say, oh, it's in the forearm, radial. Upper arm, brachial. In the chest cavity, subclavian. And as I said, axillary. I'm going to have to kind of guide you to the axillary. Right? Quickly, right here. Okay, no, we'll do that later on. Right. Then what we see is there's the back of the scapula. There's my scapula right there, the back of the scapula, and draining into the subclavian is the subscapular vein. Subscapular vein from below that. Okay, so those are the veins above the heart. Right? Now we flip everything over to the organs to the right hand side. Just very quickly in the thoracic cavity again, we see the inferior vena cava right there. Remember now, superior vena cava, inferior vena cava, SVC, IVC, standard abbreviations. Right, so there's the inferior vena cava, which runs, there's my diaphragm, there's my liver, runs through, and then there, I see my inferior vena cava again, or the IVC again right there. Right? Then on one of the handouts that you needed to add was the adrenal gland right there, and there is the vein running over the adrenal gland, usually pretty pronounced and prominent, the adrenolumbar vein. And the adrenal gland, it looks like a smaller kidney. Remember, the other name for the kidney is the renal gland. So renal gland, kidney, add a renal gland right there. Right? Then there's my kidney, and the vein draining the kidney is the renal veins, and many times on most of the cats there probably be two branches, which I can't see right there. Then draining into the renal vein on the left hand side is the genital vein right there. And once we've determined the gender, in this case a male, then that becomes the testicular vein. Later on when we do the female, that's going to be the ovarian vein. So genital, generic, and then we become gender specific. Yes? Alright. We continue with the inferior vena cava, and then it branches in the body cavity. In the body cavity. Now, as long as it's in the body cavity, that is called the common iliac vein right there. You can see the branching right there. So there it is on the left hand side, and there it is on the right hand side right there. There we can see the two branches. Now in the body cavity, there you can see the two branches right there. Right? Now in the body cavity, common iliac, when it leaves the body cavity and now it is in the thigh area, the femoral area, then it is the femoral vein. Femoral vein, right there. Then we see this little vein right here, actually, we can see it actually, I don't see it on that side, but it's going to come from this area right here, the mid-thigh area. And it's going to drain into that femoral vein, forming a T-junction. And it's going to come from the tail area. And that is called the caudofemoralis vein right there. Right? Then we see this prominent vein right here in the lower leg running across, right up against the skin. And that is called the saphenous or the saphenous vein. And then we continue, and then what happens is we come behind the knee and open up behind the knee, because behind the knee there is going to be another vein, called the popliteal vein. And the popliteal vein joins the saphenous vein, and where they form that Y junction, The Y junction forward, that is going to be the femoral vein. Right, so you see the Y junction right there. So those are the veins of the cat. Questions? Can you see over there, Rachel? Oh, you're looking at it. Right, Penny, you can see okay? Right, questions?